If you had told me back in 2006 that one day I'd be working toward becoming a psychiatric mental health nurse practitioner, I wouldn't have believed you. I've been a nurse for nearly 2 decades now, and trust me, I've seen it all. But it wasn't until I hit a wall that I found a deeper meaning and a deeper calling, and that is mental health nursing. And now I'm here to talk about it. My name is Nurse Miriam. I've been a registered nurse since 2010, and before then I was a licensed practical nurse from 2006 to 2010. And before being a licensed practical nurse, I worked as a certified nurse assistant, and that was from 2004, early January 2004 to around May 2006. Currently, I am pursuing my DNP, PMHNP. I got my BSN in 2010 April and my MSN in 2010 December. I had enrolled in an RN to MSN program. That's why it kind of accelerated quickly. This channel is a space where we talk about real mental health issues, especially in undeserved groups like older adults, nursing school survival, self-care, and how to protect your peace while working in healthcare. So, if you're a nurse, student, caregiver, or someone who just wants honest, simple talk about mental health, you are in the right place. So let me talk quickly about my nursing journey. And I'll take you back a little bit. I started out like many nurses, full of energy, purpose, and I wanted to help people. I've worked in medical surgical units, long-term care, and geriatric psychiatry. The work was meaningful, but it was also very exhausting, emotionally and physically. I started noticing how deeply mental health impacted my patients and how poorly it was being addressed, especially for older adults. These are the most ignored people, the older adults. So people were being treated like check boxes, they just check this, check that, and then antipsychotics are thrown to them, at any symptom that presents. So, and we as nurses, we were burning out trying to keep up with the broken system. So what was my turning point? Why did I choose the PMHNP program? There was a patient, an older man with dementia and depression. This man changed everything for me. He did not need medication. He did not need more meds. All he needed was to feel seen, to be heard, and to be understood. But the system did not have time for him. They kept on giving him medication. That's not what he needed. So that's when I knew I wanted to do more. That's what led me to pursue psychiatric nursing. I want to be the kind of provider who listens, who works with patients and families to build mental wellness, not just medicate symptoms. That's why I chose to become a PMHNP. I'm sure most of you are wondering, what am I going to get from this channel? We'll have honest talks on mental health content, focused on older adults, caregivers, real-world issues. We'll also talk about nursing school survival tips and encouragement from someone in the trenches like you. Mental health education that's easy to understand. You don't need a medical degree to understand this mental health education. And then we'll also discuss on burnout, balance, and building a life that feels good, not just productive. So whether you're working in healthcare or navigating your own mental health journey, I want you to feel seen here. If that sounds something you need, it sounds like something you might want, go ahead and hit the subscribe button. Tap the bell so you don't miss when I post. I'll be sharing new videos weekly, sometimes with education, sometimes reflection, and sometimes just real talk from the heart. And I want to hear from you too. What has mental health meant in your journey? Whether as a nurse, a caregiver, or human being, leave a comment and let's talk. Thanks for being here. Remember, your mental health is just as important as your physical health. You matter. Talk to you soon and see you in the next video.